Got it. Thank you. Okay. Thank you for joining us to learn more about the Young Living Health Plans. We're going to go through what a health share is, all about the plans, and also how you can earn some income from it. So let's start with some really important statistics. And it is pretty shocking to see these numbers. There's 30 million people in the United States without health coverage. And 50% of Americans owe money from medical bills. 65% of bankruptcies are tied to medical debt. And out of those bankruptcies, 90% of them had insurance. So it's really shocking to know that the problem isn't just coverage, it's the system that is really only designed for profit and not for people. So the Young Living Health Plans are an alternative to traditional health insurance and also have a really amazing holistic plan. So first, let's talk about the health plans and who our partner is. So first, a health share is not health insurance. So a health share is a community of individuals who put their money together, and we all help to pay everybody's medical expenses. A lot of people will say, like, how do we know that there's enough money? Young Living is not the only company that is in this health share. There's hundreds of thousands of people in this health share, and they have millions and millions of dollars in this pool that the community gets their medical treatments paid through. So we pay a monthly contribution instead of a health insurance premium. We have something called an annual max that acts like a deductible, but we can't use the words of traditional health insurance, so it's called an annual max. And then the difference with a health share versus traditional health insurance is traditional health insurance, once you hit your deductible, usually there's at least an 80-20 split where you're still responsible for 20% of the medical bills. And that's where that medical debt comes into play, is because sometimes if you have a really expensive medical expense that's hundreds of thousands or even millions of dollars, then you're responsible for 20% of that. With a health share, once you meet your annual max, 100% of the cost is covered. And that is huge. So one thing to note is that California, New Jersey, Oregon, Rhode Island, Vermont, Washington, and Washington, D.C. do not see health shares as Affordable Care Act compliant. In Oregon and Washington, they've passed laws that do not let anybody be on a health share. So unless you were already on a health share, on our health share prior to these laws being passed, no new health share members are eligible for either plan in Oregon or Washington. But if you're in California, New Jersey, Rhode Island, Vermont, or Washington, D.C., talk to your tax advisor to see what your options are. Oftentimes, paying the tax penalty for not having insurance is still going to give you a savings that is significant enough to make up for the fact that you have to pay for that tax penalty, and your coverage and services will probably be way better. So Clearwater is who Young Living has partnered with. They're a healthcare vendor. They can offer traditional health insurance, they have health shares and supplemental health plans. And they've been around since 2018. And this is a non-profit company. The health share side of it is a non-profit health share. So the decision making stays in our hands, and they're not looking to deny claims and do all the things that traditional health insurance is doing to keep the money in their pocket. ClearShare is the health share portion of Clearwater. It's not insurance, just to remind you. Every dollar goes back into the community. And with this latest version of this health plan, there's no claims process. It's important to know there's no network, so you can see any provider anywhere in the United States. And if you have the holistic plan, holistic practitioners are included. If you're healthy, and you tend to not go to the doctor, then a health share is a great option. If you have medical issues, diagnoses, chronic disease, the health share part of the plan might not be your best option if you do need to go see a doctor on a pretty regular basis. But the holistic plan might be something that you might be able to really benefit from. So the holistic plan includes functional, integrative, and holistic care. And the real-time settlement of the newest add-on to this plan with Savos Smart Pay eliminates any claims and most of the reimbursement issues. Okay, Allie, you want to take it from here?
I'd love to. Thank you. Okay, so this is a modular plan offering, which means that there are three different components to this plan. So Carol was talking about the health share portion. So that is something if you want to exit the matrix of traditional health insurance for your traditional medical and emergency care, that is the clear share portion. Then we have something that is super special to Young Living that no other company has. This is only between our partnership between Young Living and ClearShare. And this is the holistic plan offering that we got to build together, which was amazing. And then the third is the combo of the two. So your ClearShare only, this is your medical. Oh my goodness, there's a car accident. Your kiddo jumped on the trampoline and broke an arm. This is what you go to for your emergency traditional medical care when you need to go to urgent care or a hospital or to see, a traditional type of doctor for something. That being said, our holistic plan does also offer access to traditional doctors as well as any holistic licensed practitioner as well. So the holistic plan, there's no copay required, and you do not have a max out of pocket that you must meet before you see a holistic practitioner. With your ClearShare side, there is a max out of pocket, but once that is met, then you have 100% coverage. And then your combo plan is the best of both worlds. So you have your emergency care covered and you have your holistic care covered. And basically for the same price or less than traditional health insurance, for most people, it's significantly less than traditional insurance. You can have both the ClearShare and the holistic plan combined for less money than you would typically pay for traditional insurance. And we're going to go through some numbers. You're going to see it's pretty amazing. So this new add-on to the improvement to our existing plan. So this plan has been offered now with Young Living for, I think, 2.5 years now, if I'm correct. Is that right, Carol? 2.5 years, a year and a half? I think it's 2.5. So ClearShare partnered with a company called Savos, which happens to be right around the corner from Young Living's headquarters, which is pretty cool. But they are digitizing and streamlining how we use the plan. So now when you go, I'm going to talk holistic practitioner because this is most of us who leverage this plan. We use the holistic way more often than we would use the traditional health share, right? Because we are going to our practitioners often, like our chiropractors and acupuncturists, massage therapy, and we'll go through that in a second. But how you use it is you just open the app, you click that you're doing an in-person visit, you select who you're going to see, and then as soon as you select all that information, a credit card number, a one-time credit card number is automatically loaded into your phone. And when you go to checkout, you just pay with that credit card number. If you decide to go all out and do fancy things like me, where you go to the chiro and the massage at the same time to really leverage the plan, there might be a difference. So for me, I pay $175 and then I pay a difference because I've also added on a massage and I pay additional like $25 to get both at the same time. And I use a separate credit card, my own personal credit card, to pay any difference above my $175. So there's no need to file a reimbursement. I just take a picture of my bill at the end and it'll ask me for follow-up in the app. And I just upload that picture from my phone and that's it. There's no reimbursement. It's already paid. It's pretty fantastic and slick and amazing. And we'll go through some details of the numbers in a second here. You could go forward, Carol. So this is the old way of like a traditional plan versus the Young Living Health Plan way. So the old way is you pay out of pocket for whatever practitioner, and then you wait 90 to 180 days for a reimbursement. This new way, you just pay automatically with your automatic credit card on your app. They're not in our network. There is no network, which means everyone you want to see is in your network as long as they're a licensed practitioner, or they're listed on things, the offerings, which you'll see in a moment here. So there's no rejection based on a provider as long as they're licensed or on the list, like a licensed massage therapist or an IV drip, et cetera. No surprise bills. You know exactly upfront what your practitioner's bill is and what you're paying them. And the holistic providers are almost never covered on traditional insurance. And pretty much all your holistic practitioners are covered now with no copay whatsoever. You can go forward. Okay, so this is what the app looks like. I was so eager to show you. So you can see here, when you open the app, you immediately are taken to, a screen that says, are you doing an in-person or a telehealth visit? Once you click an in-person visit, this is what your phone will look like. So when I want to go see the chiropractor, then I just click holistic visit and set it up. When I purchase from Young Living, I pay for my order. This is the only case of reimbursement is when on the holistic side, when I go see Young Living, I remember when I purchase from Young Living, I click Young Living and I submit a picture of my order and I'm immediately reimbursed for my Young Living order. And that is now all Young Living products minus the pet line. It's pretty amazing. So no copays, like I said. And if you have any issues, they have a fantastic messaging platform that is built into this app. So for instance, for me, I now have an 18-year-old. So I had to split her off of my app onto her own app. It's automatic now. So I needed to message them to send her phone number and her email so that she could use the app on her own. And instantaneously, they got her up and running. It was fantastic, as just a great example of support. You can go forward now, Carol. Is it your turn?
Oh, okay.
Go for it.
So there's 3 steps to any kind of visit. Like Allie said, you're going to book your visit, you're going to open up your app, and you're going to select virtual visit or in-person visit. So we're going to go over the virtual benefits in a moment, which are priceless. In-person visit, you're choosing if you want holistic care, primary care, urgent care specialist, imaging, procedure, or even mental health care. And then you're going to schedule your visit on this app or tell them that your visit happens on this day or happened in the past. And then the funds will automatically be loaded to that virtual Visa card, one-time use. The practitioner will need to manually enter that Visa card for now. They're working on it being a tap situation. But for now, to ensure that it's feasible and no fraud can happen, they're manually entering the Visa card number. And then $0 comes out of your pocket if the amount is under the approved benefit amount. So when you go see your provider, especially for medical situation visits, you're going to let them know that you're paying as a cash pay price. And I'm sure you've seen the reels and the things online that when people say they're cash pay, the price is significantly less. So there's not going to be any claims to file, no reimbursements to chase. You get the amount that's approved on the spot. So for example, if you had to go for a knee surgery, you could set up a knee surgery visit through the app. It would tell you what that approved benefit amount is. Let's just say it's $10,000. Then you can have the freedom to shop around to see what doctors charge $10,000 or less. Or maybe you find the surgeon that is the, best one in the area, or it could even be somebody out of state. They charge $15,000. You would know $10,000 is going to be the approved benefit amount and that you would be responsible for the $5,000. You would also be responsible for your annual max, which is like your deductible. But it's still just gives you the freedom of transparency and the freedom to choose what you want to do, the kinds of services, whether you want it under the approved benefit amount or if you are willing to pay above the approved benefit amount. So this is a really great chart showing what is included in all of the plans. So ClearShare covers emergency urgent care. You also get $0 telemedicine through a company called Amaze, and you also get virtual mental health services through Amaze. You get $0 telemedicine 24/7, 365 days a year. You can call Amaze through the app and you'll have a doctor or a nurse practitioner on the phone, video call or phone, within 10 to 20 minutes. They can diagnose things, they can do concussion protocol, they can prescribe things. They can tell you, does this require more care? Do you need to go to urgent care? That kind of thing. With mental health, it's through Amaze. You get the same therapist every single time. It's 13 30-minute sessions for free per year. Childbirth and delivery is included, and birth centers and home births are included as long as it's with a licensed midwife. The one caveat is you do have to be a member before you get pregnant. So if you have friends that want to join this plan, make sure that they're joining before they get pregnant, because even if they enroll and then the timeline goes back to when they actually conceived and it's before they enrolled in this plan, that would not be covered. Most generic prescriptions are covered. You've got your Young Living product reimbursement, functional nutrition and medicine, and all of these things. So the best plan, obviously, is the ClearShare and holistic plan because you get all of these things covered. With just the holistic, you don't get everything. With the holistic savings, you do get everything covered. The best plan, though, is the holistic plan because you get 35 visits per person for the doctor visits and massage. We'll go more into detail with that, but you get $175 covered versus $150 with the holistic savings plan. And with the holistic savings plan, you're only getting 15 visits per person. So with the medical emergency plan, all accidents, emergencies, catastrophes are included. There's no network, you can go anywhere, and there's no limit on the number of family members. So if you have a large family, a lot of plans charge you extra for having more than 5 or 6 kids. So emergency visits, hospital stays, even international treatment, which we're going to talk about in a little bit, is covered in the event of an emergency or long-term chronic illness. And then in the ClearShare medical and emergency plan, you do get some occupational physical therapy and massage therapy coverage. It's very limited and it's only approved for a specific medical issue. So that's where the holistic plan comes into play, where you don't have to get pre-approved or any of that. So with all of the ClearShare medical and emergency plan, you do have to meet your annual max first. We'll talk a little bit more about that in a moment. Next, these are the holistic care benefits. So if you're into doing holistic services, this is the most innovative, robust, holistic plan out there. There's nothing else out there like it. You get chiropractic care covered, and you get Young Living product reimbursement, everything except pet products, but it does include animal sense ointment. We at least talk them into that. Acupuncture, a wellness visit if you want to go to see a DO or an MD or a naturopath, or maybe you want to go get your skin checked at a dermatologist, that's included. Breast imaging includes thermography, QT imaging, ultrasound, and other breast imaging options. IV drip therapy and injections. So at-home injections like vitamin C, glutathione, NAD, those are included. Primary functional care, so naturopathic doctors and even massage therapists, physical therapists, functional nutrition therapy practitioners, registered dietitians, all included. And you also get that $0 telemedicine. So if you go see a chiropractor or any of these doctor kind of visits, you're going to get $175 for the holistic plan paid for. And if you have the holistic service, you're getting $150. So for example, with the chiropractic care, my chiropractor, the lowest that she charges is $55 for like a 10-15 minute adjustment. I'm not going to use up my $175 with just a chiropractic visit. I'm going to add on a massage or a facial, or even I've added on Reiki or sound bowl healing at my acupuncturist to make sure that I'm at that 175 or over so that I'm maximizing my reimbursement. So the $0 telemedicine, like I said, is anytime, anywhere, 24/7. And you get the $0 virtual mental health, 13 30-minute sessions. And these are included in every plan. Okay, Allie, you want to take it from here?
Yes, and I am super excited about this. And we were actually given permission to actually make a slide about this because so many people in the Young Living community, if they are unfortunately diagnosed with something like cancer, they may not want to seek traditional Western care. And the CEO of ClearShare was very specific to tell us that they support and encourage people to seek alternative care. And so if someone is diagnosed with cancer, they have the opportunity to work with ClearShare to go to utilize alternative and integrative treatment options. They do not have to use US standard of care. And certain situations, what they'll do is they'll work with clinics in specifically Mexico where they're allowed to do things legally that we cannot do in the US. And it's pretty amazing because what they'll do is they'll put a member, a ClearShare member up in a 5-star hotel in Mexico and get them the treatment that they need, holistic treatment that they need. And they just have to pay their max out of pocket. Everything else is covered by ClearShare. So bottom line is you are never forced to use a treatment in the US that you don't want to use, which is really, really amazing. I've never heard of this with any other company. So it gives us peace of mind personally as a family. It's really amazing. Yeah, you can go to the next one, Carol. Okay, so there are some limitations for ClearShare. Like Carol was mentioning before, a health share plan is really set up for people who use their medical coverage for emergencies. So you are a generally healthy person and you want to stay healthy and you just want to have an emergency health plan. So this isn't someone who has severe medical issues or they will be disqualified. So there's a few look backs they call them a look back. That means if you've had cancer, a heart attack, or stroke, or you have COPD diagnosed with any of these things in the last 5 years, they're going to look back at what you've been diagnosed with, and there's a possibility you will not qualify for the plan. So if you've been diagnosed with anything serious in the last year, for 1 year, you would not be able to get coverage. So you might ask, why would I sign up for this at all? Well, maybe your spouse, and your children, you want to get signed up for the plan. And maybe it makes sense to sign up one of the spouses and the children, and then add on the other spouse in the second year where they can get coverage. So that's just making you aware of where the scenarios are where that would make sense. So if you have had a diagnosis or a treatment in the last year, then you would not be eligible. In year 2, you'd be eligible up to $25,000. So if you need medical care, you're capped at $25,000, not unlimited. Year 3, $50,000. Year 4, $125,000. And same thing for those 4 conditions that we mentioned: cancer, heart attack, stroke, and COPD. Carol also mentioned that if you are pregnant before you join the plan, your pregnancy would not be covered. So that's something to think about. If you are becoming pregnant, you might want to, or are already pregnant, you might want to keep your traditional or other health plan. And you could also, though, for sure add on the holistic until the pregnancy is over, and then you can go back to having the combo plan. And it's really flexible. What's great is that you can sign up one spouse for one plan and the other spouse for a different combo of plans. Certain exceptions that are not considered a look back is high blood pressure, high cholesterol, type 1 and type 2 diabetes, and hypo and hyperthyroidism are not considered an exception to the plan. So you totally can be covered with any of those things because they can very easily be managed with oils. And also, if you are someone Western, if you want to manage them with medication, that's up to you. But I would suggest using oils first. And then tobacco use. So there is a surcharge for someone who is a smoker, and there is a limitation on what they will cover up to $15,000 if you get sick with a tobacco related illness like lung cancer, for instance.
And one
Okay.
added caveat with the look
Yes.
back period, it for the 1 year look back period, it's the coverage is for that specific illness or diagnoses. So if you have other issues, those things will be covered. But if you had, a stomach issue or a back issue and that reoccurred after 1 year of no medical exam, diagnoses, or treatment, then you would have up to 25,000 covered. So the 1 year look back is just for that specific diagnosis or treatment. Any other thing that were to occur that was new or different would be covered under the ClearShare plan.
Okay, so your family annual max. So if you are used to a traditional health insurance, an annual max equals a deductible. So you might be used to the word deductible. It's literally the same thing. We just don't use the same language with a health share. In this case, you can see here, so you have three different tiers of your annual max. So this is kind of your biggest decision point when signing up for a plan is do you want to have a $1,000, a $2,500, or a $5,000 annual maximum. And then from there, you can look at the pricing, which you'll see shortly. And you can see there's a member only price. So one person, there's member plus children. If you either, so a scenario if you have a single parent, or let's say that my husband works for a corporation, he gets amazing coverage for himself, but it's really expensive, or I don't like the plan and I want to put myself and my children on a different plan. That's where you'll see one member plus the children. And you have another scenario with no children. And I also want to mention that children are covered up to 26 years old and they do not have to live in your home. So that really kind of broadens what you look at from as well as this is a great plan to add kids onto up to 26 is huge. It's kind of unheard of in the industry from what I understand. And then obviously there's a member and the rest of their family. So those are the annual maxes. So if a person, let's say, someone in your family falls off their bicycle and they have to have a broken arm situation. And so they have an annual max for themselves. And then they'll have a family max, meaning, okay, two people fell off the bike at the same time. And so you'll have one number that's a max out of pocket for, let's say, $1,000. And then let's say it's you and your spouse on the plan and you both fell off your bike at the same time. You'll have a $2,000 max family. And you can see it differs a little bit based on how many, which plan you're on, what your family max coverage, max out of pocket is. So that max out of pocket is only for your major medical. So this is your emergency room, ambulance, hospital stays, surgeries, physical therapy on the medical side of the plan. Anything I missed, Carol?
I just want to highlight for traditional health insurance, you have your deductible. And if four people, if my family was in a car accident and we all needed hospitalization, we would all be responsible for that deductible amount. So this family annual max for me and my family, we have the 5,000 annual max tier. We wouldn't be paying 5,000 for each family. The max would be 10,000 for our family. So it is overall a savings.
Yes. Let's hope that not everyone in the family
Right.
uses their. Yes. Okay, so then so let's talk about the holistic plan specifically now. We have two holistic plans. Either of them can be individual or either of them can be added to the ClearShare plan. The first is the holistic savings plan. This was something that we added after the original plan was launched as people were wanting to have an option that was less expensive. So it still covers your $0 telemed. There's no annual max. There's no pre-existing conditions. You can join at 65 or older. There's no deductible when you use any of these holistic services, but you are limited to 15 visits per person per year, and your max amount is $150 per visit that is covered. Same practitioners are covered. However, IV therapy is not included on this plan. And your Young Living products are still covered at $50 if you're just covering yourself, or $75 for couples and families. Now, the holistic plan covers way more. And when you do, it's hard to even think about using the holistic savings once you run the numbers, especially with no out of pocket and no deductible to use this plan, because you get 35 visits a person per family member at $175 versus $150 a person. IV drips and injections are also included. You also get a $350 breast imaging option, which can be used at all kinds of different imaging options, including ultrasound and thermography, which is very rare to be covered on any other plans. Your Young Living products are still reimbursed $50 to $75, depending on if it's one person or a couple and family. And then you get your generic prescriptions covered as well.
I just noticed that we didn't update the description. The costs over 350 for breast imaging are the member's responsibility. It was 200, and
Oh,
we
and
were
in
able
the
to get them to
description.
increase it to
Yes.
350. So I'll
Yes,
correct
we
that
did
later.
fight for that. Good job. Thank you. Update that. Okay, so this is just a highlight that just with the Young Living reimbursement you get alone, you're getting $900 back a year with Young Living product for free if you're two or more people in your family, which is a huge savings. It's pretty amazing. And all of our products, so even our skincare, even our cleaning products, it's all included now, except for the pet stuff.
Okay.
Okay.
I don't know why this is
Maybe
not
hit
showing.
refresh on your browser. What happened? Do you,
Weird.
yeah, hit the little refresh on your browser, top left, next to the browser window. See it down at the bottom in the preview.
I know it shows in the preview, but then it doesn't.
Oh gosh.
Hmm.
Hang tight. We promise there's pricing to come.
Come on.
Oh, yeah, like two more. There we go. Yay. Okay, let's see. Hopefully it shows up.
Okay, full screen. There we go.
Okay. When the slide clears up, which it should shortly here, you'll be able to see the pricing. There, it's starting to clear up on my screen. It's like coming out of fuzziness. But you'll see that they're on the very top. I mean, it's amazing what the marketing guy did to get all this in one page. I'm just going to tell you, he worked magic here. But you can see that you have single, couple, or single with kids, and then family with kids, and then an age bracket. So that's the first thing you want to look at to figure out, is it just for yourself? Is it for you and your children? Or is it for you and your husband or spouse or significant other and your children? And then you'll look at your age bracket of the oldest person in your family. And then you'll see which one you want. So the number one is the combo plan, ClearShare plus the holistic savings. And then, and you'll see there's also a PV range. So if you are looking at how much your PV each plan is worth, there's a range based on age, just so you know. or I'm sorry, based on what your max out of pocket is, I should say. And then this number two is clear share only, so only major medical. And then number three section is the pricing for holistic, which is more simplified because there's no age qualification. And you'll see at the bottom is just to clarify, the holistic is 35 visits at 175. Holistic savings is 15 at 150 with some other small limitations. So you can take a screenshot. It looks like it finally cleared up on my end. So it came out of haziness. But we'll also share a link to this presentation so you can have it later as well. So you don't have to memorize anything or write anything down. Get that for you. I think it might be your turn, Carol.
Okay. So some people might say this seems way too good to be true. And it would seem too good to be true because it's crazy how much people can save and the services that you can get. The reason why this plan exists is because ClearShare believes in the fact that people that are proactive about their health and wellness tend to have lower long-term health costs. So they're willing to invest in us now, especially with this holistic plan, because we do tend to get sick less and we tend to avoid expensive emergency interventions, and we're not on a ton of medications because we use our Young Living products to stay healthy. So they're willing to invest in us now because we will save them hundreds of thousands of dollars later. So that is the kind of company that ClearShare is all about. They really align with what Young Living members want, and anyone that wants to use and does use holistic services. Really, we want to be proactive about our health and wellness, and ClearShare wants to do that too and reward us for that. So taking an example, if you have one person on the holistic plan just by itself, the one that comes with all of the services at $175 approved benefit amount, it's $233 a month. So $233 a month costs $2,796. If I were to do all 35 visits at $175 approved benefit amount, that's $6,000, over $6,000 worth of services. Plus, if I did my annual breast exam and I got the $350 paid for, and since I'm an individual, I'm getting $50 worth of Young Living products a month, that's $600 a year. I would be getting $7,075 worth of services and product for $2,796, which is an insane amount of savings. And most people that do all these kinds of holistic services tend to not do as many as they want to because it is all out of pocket. But with this plan, you can do 35 visits, and it's 35 visits per plan year, and the plan year is May through April. So anybody that's signing up now, you have 35 visits until April. I had a friend of mine enroll someone that was needing acupuncture for a kidney issue, and he signed up 2 months before the plan year ended, and he had all of those visits to utilize for himself to get help and support for his kidney issue.
Carol, I wanted to chime in for just a second because I ran the numbers for my family on the same scenario and assumed I didn't have the major medical, and I just did a family of 4 on the holistic plan. And our savings was just under $27,000 for the 4 of us.
Wow.
Yeah, we need to make another slide.
Yeah, we need to have that slide. That's insane. Okay, so who's eligible to enroll? The cool thing is this is a monthly enrollment period. There's no waiting periods. You don't have to wait for a specific month and then have to make that decision. Anybody can enroll any month of the year. The way that it works is you would enroll this month and you would have services the first of the following month. So any current Young Living member has access to these plans. Any non-Young Living member can just create a membership to the ClearShare plan or the holistic plan. They'll automatically become a Young Living member. Anybody who has an ITIN number. No social security number is required. Anyone 65 and up is eligible for the holistic or the holistic savings plan. Unmarried children up to the age of 26, even if they aren't living in your household, count as part of your family. And you can sign up your spouse. So if you are a Young Living member and you have your spouse underneath you, then the spouse account can be the account that the health plan is enrolled under. And that way you can earn a little bit of commission every month from your health plan. So let's say you already get great employer coverage. You can still look at getting the rest of your family covered on the ClearShare plan, because typically employer plans only cover the employee, and then it's extra to pay for the rest of the family. So it would be really worth your while to look at what it would cost for the other spouse and the kids to be covered on the ClearShare plan, because it probably will be a fraction of the cost of what the employer plan would be. And then everyone could sign up for the holistic plan benefits. So you would get a whole lot of savings and get access to all those really great holistic services. So signing up, you go to the enrollment page. This go here just goes to the Young Living ClearShare plan. If you are watching this and you're new to Young Living, please refer to the person that sent you this presentation so that you can get their referral number. You're going to choose your plan, follow the prompts, choosing your annual max and your household type and the age range of the oldest person within your family. Really takes about 10 minutes or less to sign up. And then you want to just make sure you're enrolling the month before you want coverage to start. You'll be billed the month you do enroll, and then the first of the month following your enrollment is when you'll start having services. So here's some health share comparisons, because there's a lot of other health shares out there: Impact Health Sharing, Samaritan Ministries, Crowd Health. This is our ClearShare plus the holistic. As you can see, there's a lot of benefit with our plan. Our plan might be, with the ClearShare plus the holistic, might be slightly more expensive than any of these three plans. However, when you look at all the things that are covered and not restricted compared to the rest of these other plans, you'll see that the services and availability of coverage that you get with our plan is worth paying a tiny little bit more. It's not hugely significantly more, but you get so much more coverage and many more services because nobody else has the holistic plan like ours. Okay, Allie, you want to take this part?
Okay. Unmuted. It helps to unmute yourself. You never have to share anything good in your life, right? You can keep it to yourself. But if you want to help a friend out, or maybe you want to make a side income by sharing these plans because you believe everyone should be able to exit the matrix of traditional health insurance, as I like to say, you might want to understand how you can get some recurring income by sharing these plans. So you can go to the next one. Maybe. There we go. Oh,
yeah.
We won't. Okay. So the nice thing about a health plan is that most people stay on it for a long period of time. And so for every month that they are on a plan, you are getting a thank you check from Young Living for being the one to share them. This is great for sharing with friends and family, your social network, but this is also great for small business owners who aren't required to offer health insurance to their employees, but they would like to as a way to keep their employees happy and staying with them longer. And it's also fantastic if you're already seeing holistic practitioners. Why not share this with them and how they can help their patients save money? And also the holistic practitioner can earn a side income too, or not. It's all up to them. It's great. There's so many ways to share this. So what's fantastic from a practitioner standpoint is that they can share this plan which allows their patients to see them more often as a practitioner. It's really a no-brainer for them. They can just have some flyers in their office that talk about the plan, and they might mention it during an appointment that, if someone says, oh, you're too expensive for me to see you as much as I want to, they can share this plan with them. They can, no matter if their patient is older or maybe they're not well, there's always that holistic only option for them, which gives the patient so many benefits that we've already been through. I think we can, and for the practitioner, just a reminder that they get paid upfront, which is most practitioners have to deal. A lot of them, I would say, have to deal with insurance, or maybe they lose patients because they don't want to deal with insurance. So this gives them a way for their patient to pay at checkout with that app that we talked about, and it gives them an option to have a recurring income stream. So this is kind of some crazy numbers if you look at it. If you have been sharing with Young Living before and you understand how it takes to get to one rank, we wanted to break this down by rank and the average income by rank to see how quickly this adds up when you're sharing the Young Living health plans. So we made some assumptions. For an example, you've got someone signed up with a combo holistic and clear share savings plan. They're 40 to 49 years old, which means that their plan is worth 101 PV point value or product value a month. They're going to max out on their $75 for their loyalty program, which obviously if you use Young Living, if you're going to spend $75 for reimbursement, you might as well spend $100, so at least you get that free promo. And it's real easy to spend $100 a month once you're starting to use all of our supplements and products, and everything is covered now. So we made the assumption that someone is going to their account is going to be worth 176 product value PV a month. You would need 3 people on that plan to be a star. You would need 12 to be a senior star. You would need 23 to be an executive, and so on. So you can see how this can build very quickly, especially if you're sharing with practitioners. And then on the right side, you'll see the average annual income for someone sharing these plans. So this is an average income, and you have to also recognize that if you understand the Young Living commissions or compensation plan, you'll know that this is likely going to be higher because people are going to be spending every single month versus people that you have on your team that may be members that are not spending. So you need a whole lot fewer people to get a higher recurring income. So we talked already about in that example how you really are getting 2 streams of commission every single month. You get one for the health plan because it has its own PV value, and then you get one for their Young Living product spending that they are reimbursed for, or you are reimbursed for. So I also should say, if you are married and you want to be on this plan with your spouse, I would suggest that if you are the primary Young Living person, that you enroll your spouse on this plan, and you will be paid for your own health plan, which makes me laugh. It's just kind of crazy. But so there are 2 income streams. So the health plan and then the Young Living products, and it's free. So anyone can share these plans and be eligible for the bonuses. And then obviously if they're already on the health plan, then they're already eligible most likely for commissions as well. So how timing works on the commission. So the first is the person enrolling on the health plan is going to enroll in the month before they want the coverage to start. Month 2 is when their coverage begins. And then their commission is always paid the month after their spending. So they'll be paid in month 3 is how their first commission check will be in that person's month 3 of their plan and being in action. Is that the word I'm looking for? Effective.
Yeah. Mm-hmm.
Enrolled. Effective. There is a fast start bonus that you will earn. So the fast start bonus is 25% commission in their months 2 and 3 of their enrollment. So they'll sign up in month 1, their coverage begins in month 2. Month 3, they get 25%. Month 4, they get 25%. And then going forward, they get uni-level commissions, which is dependent upon where they placed in your organization, between 4 and 8% of what that person's monthly PV is worth. Okay. How does this all work together? Do you want me to hand this to you, Carol, or do you want me to finish this up?
Go ahead. Yeah.
Okay. So ClearShare is responsible for all of the health share and holistic piece. Anything to do with getting your health paid for and your Young Living products paid for and all the administration of the plan, that is ClearShare. Young Living is responsible for a landing page on our website, what the product value is worth, the commissions that go to whoever is sharing, and all the brand partner tools and resources. You, if you are sharing this plan, you are responsible for sharing with others, making sure that you are, watching your Young Living website, and just sharing as you choose. So that's kind of how it works. All this works together. Okay. You went.
All right. So if
Yes.
you are interested in learning more and you want to become a brand partner, it's free. You just create your Young Living account, then you can contact customer service to upgrade to a brand partner at no cost. If you're already an existing Young Living member and you're a customer, you can upgrade to become a brand partner for free. You just log in, go to your drop down menu, and it'll say become a brand partner, and you can just upgrade to that brand partner level for free. We have a Young Living Health Plan Facebook group. The QR code is right there. Lots of information on how to share, testimonials, there's training. This video will be in there. Tons of information about all the details of the plan are in that Facebook group. You're welcome to add your interested people to that group. And also, if you're a Young Living brand partner, any of your team members can join that group as well. So real stories from real members. So Allie has this great testimonial. She is loving knowing that her family's protected in case of anything catastrophic, but the holistic needs that are covered are just so amazing. So this is the first healthcare plan that actually fits a Young Living lifestyle, a holistic lifestyle. This is from Shelly Garrett. Her family was with a different health share program and it didn't cover the holistic services, so they were still paying a lot of out-of-pocket costs. Now they don't. So this is really built around our kind of lifestyle. This is my sister, Yvonne. She was paying $800 a month. Her deductible was $10,000 and she's saving a ton of money with the combo plan. This is my story. We had a PPO that we were using. We rarely ever used it. That PPO, if it was still the plan that we were on, it would be $3,200 a month with the $7,000 deductible each person. Now we're saving $20,000 just on our monthly healthcare coverage. That's not even including the savings that we're getting from the holistic plan and the Young Living reimbursement. So this person, Marcy, was able to call the telemed on a Saturday. She got prescriptions filled. She was literally in the middle of nowhere. I think she got bit or stung by a bee, and it was really bad, and it gave her peace of mind, and it helped her get the prescription within, the day. So here are a couple different people and their testimonials of what they're saving each month or what their friends are saving each month. And like we said earlier, this plan is available throughout the United States. So Lindsay's been sharing with chiropractors, acupuncturists, and naturopaths. Nathan used the telemedicine and got everything covered through telemed. And then Lori has a really great story. She's divorced and couldn't afford health insurance. And now that she can be on this plan and share about it and earn some income, it's really an answer to her prayers. So that's the end of this presentation. Thanks for joining us. If you're new to Young Living, make sure that you are getting the referral link from the friend that shared this with you. If you're an existing Young Living member, you can go to yl.clearwaterhealth.com for a free quote, a consultation, or to enroll directly. And remember that coverage will start the first of the next month. And join our Young Living Health Plan Facebook group for ongoing education, sharing tools, member stories, and community support. Okay, so stopping the share.
I was just trying to go through all of these messages. Yes, a couple of things we can share. I'm going to actually share the board real fast. We have created a bunch of resources for everyone, Team Young Living. And I'll share the board here if I can get to the right browser window because I have too many browsers open. Okay, that has a link to this presentation. So it'll be a live link. So anytime we make updates to it, you will be able to see those updates. Copy link. There we go. Okay, if you have not used boards yet, highly recommend you download that app. It is fantastic. And it has everything in it. So there's like a one pager on the pricing. There's, we'll be adding more social media content. There's some now. There's a link to make flyers for practitioners where you can add their QR code or your QR code. There's one pagers just for a normal person that's not a practitioner. So a lot of the questions are, oh, Naomi, I just answered your question. Yes, so there's one pagers that you can put up in your office that have your QR code on there. Do you want to? I'm trying to scroll through all these.
There's a trifold that you can print out that gives an overview of the plans as well. There's even an expandable sign. So if you wanted to do vendor events, there's that. If you want a Young Living Health Plan t-shirt, I made some in my Etsy shop that you can make. Okay, so questions. Allison asked, is the part under routine just with ClearShare? Yeah, so with ClearShare, routine, wellness, preventative stuff is not covered. That's the medical emergency plan. With the holistic plan, you get 35 visits. If you want to go see a doctor for a routine checkup, wellness check, whatever, you get to go see a doctor, a DO, and naturopath, any of those practitioners, no network, anytime you want, no pre-approval, nothing like that. It is not usable in Mexico unless you get approved for cancer care. If it's just regular holistic care, it would not be covered. If you have the ClearShare medical emergency plan and you have an emergency medical situation while you're traveling, then you can submit that and more than likely get that covered. So if you get charged less than the approved benefit amount on the holistic plan, can you add a tip to the card? Yes. All you're going to need is the invoice with the total amount that you paid. It doesn't matter if part of it is a tip, and you will get either the $150 paid for if it's holistic savings or $175 if it's the holistic plan.
I would recommend you don't get a super bill in that case. You just get a bill that shows the total value of your visit. Just wink, wink. None.
If the Young Living Nova Vita Spa in Ecuador is covered, unless you were going there for cancer or some kind of long-term chronic thing that was new to you when you enrolled in Young Living, I don't think it would be covered.
I think we should ask that question though, Carol, because they do have a doctor on site. I want to follow up on that one.
Yeah,
because
it's worth asking for sure.
Yeah.
Okay, if your chiro doesn't offer a massage or acupuncture, does that mean that it would be another visit? So if the chiro is in a wellness center that has massage, acupuncture, like my chiro has a facial person, like an esthetician, she does cold laser. She also has soft wave. She's got all these gadgets. You can add on anything on the same day as long as it's under the same roof to that visit. In that case, you would want an itemized bill that says chiropractic for this much additional, what other service you would add on, and have that be itemized on the visit. So yeah, you definitely would want to find the wellness centers that have a chiropractor or acupuncturist under the same roof, so that you can add on those other things. And really, the benefit is you want to maximize your 175 or 150, right? Okay. Looks like the holistic plan covers everything the ClearShare plan covers except for ER and childbirth. For the most part, yeah. Except if you have, yeah, a medical issue. So if you go to the ER, it counts towards the annual max. Yes. So if you go into the ER, I believe you would pay, I think it's $500 you would pay immediately, and then you would wait until whatever your illness, diagnosis, whatever is, and then the app will tell you how much would be approved, and then you would deduct your annual max from that. And then you could pay the rest, whatever's remaining, with your card. Okay, let's see. Yes, we're going to have this recording available afterwards.
There's Carrie, you don't have to buy flyers. There's free Canva flyers that you can customize and just have printed wherever you want them printed.
Yeah, they're all on Canva Pro, so if you want to edit it to make it fit your branding, we tried to do it so that it was as generic as possible. So care coordination exists with the new plans. They're still working that out. So there was this really great perk of care coordination where if you had a non-emergency situation and you use their provider that they recommended, annual max would be waived and your care would be covered. Now that the app has switched to, it's more of a self-pay, cash pay, instant pay situation, they're still trying to figure out how the care coordination system would work.
But the nice thing is you can immediately see how much you can get for any, like how much they would pay for any kind of medical procedure. And so you can just go in and see how much it would be, and then you can negotiate that with any provider. In addition, you can use the Messenger app as well and just say, hey, I'm looking for someone who does this in my area. Can you help me find someone? They can help with that as well. If you have clear water, is it easy to convert for wild plan? So if you have clear water, like not through Young Living, then you would need to give them a month's notice to cancel the plan, or if you might need to have a letter that I just had to do this for a friend. I wrote a letter that she's going to be sharing, like she has a new business and she got off of her existing health plan. And then she signed up as like a brand new member. So I don't think it's an easy, like they don't convert it for you. You have to manually get off one and join the other. That answers your question, Linda Campbell.
And you can keep your United Health for dental. There is dental and vision supplemental add-ons if you want to add on. The dental, in my opinion, is not worth it. There's a network, and at least in San Diego, the network was all the people I would not want to go to that have really low ratings, and it's pretty limited. So the vision was pretty decent. So we did the add-on for the vision, but probably can cancel that because we don't even go to see the eye doctor really. How much PV do you get paid for the holistic plan for a family? It all ranges based on age and how many people. So
For family, it's only 32 PV. It's pretty low PV because they wanted to max out the offerings of the plan. So you're really getting more of your benefit from having someone buy Young Living in addition to Young Living products. But yeah, it's 32 PV for family.
yeah, so
For
just the
regular.
holistic plan does not give you a ton of PV in terms of what you can earn commission on, but getting them to use our products because they're going to get $75 back a month, that's where you would get the commission. And then just sheer number and volume of people that you can get on that plan will help you earn more. Okay, so yeah, have your husband sign up under you. ClearShare covers vision and dental. It's additional, but like I said, the dental's not really worth it. If you only want emergency coverage, your max out of pocket is all you'd pay in an emergency. Yes. So it's the 1,000, the 2,500, or the $5,000 annual max if it's just you. Okay.
Yeah.
IV drips and breast imaging are not covered with the holistic savings plan. Oh, okay. I'll check the chart. Thanks. The name of the health plan on boards. I believe Ali put the link in there.
Yeah. You can't find it. You have to have a link, just FYI. You can't just search for it.
Yeah.
I think that's what you're asking.
What's the
I'm
best way
done.
to use it with a HSA?
Okay, so I'm going to tell you how I do it, and it depends on what what you how you have it set up, an HSA or an HRA. What we do is we use our, remember I said I go to the chiro and I get a massage. I use the 175 and then the difference I put on my HSA card. So I use my HSA card that way. I don't think legally you can pay for your health plan with your HSA. We have an HRA, so I do use that to pay for our health plan.
Right. You cannot
Did you get
prepay
the
a
one
couple
about the
appointments.
what time stamp are you on the questions?
I'm at 202.
Oh,
I'm at
okay.
Michelle's question. What's the best way to use
Oh, I
HSA?
missed it. Someone asked about do we get 25%? Nina asked, do we get 25% off your back from your downline? You get 25% bonus. It's a bonus a Young Living that gives in someone's first 3 months. And in this case, because they're not actually starting their plan until month two, you get paid in months their second and third month of using the plan. Just to be clear, the 25%. And then it goes to what we call unilevel payout, which is let's just say 8% if they're right under you, and it drops from there depending on how you strategically place, which is a whole nother phone call. We can send you a comp plan video.
Okay. Is there any reason we can't prepay a couple appointments to meet the 175? You have to do each visit at 175, or it can be less than that, but like we're saying, ideally you can
Oh,
add something on to get the full 175 maximum reimbursement.
I would just say if your provider is creative, there's that.
Yeah. Okay. If you have an iPhone 13, will this work? I'm not
Oh,
sure
and
about
someone
the app.
commented later that it did work for them.
Okay. Yeah. And there's a website that you can use too. So, okay. Unmarried kids up to the age of 26. So it's unmarried. If they're married, then they would be on their own plan. Philadelphia, Pennsylvania law says insurance must pay for kids up to 26, but this is not considered insurance, correct? Are colonics included? Not as an individual service, but if the colonics are under the same roof as a chiropractor or acupuncturist and you add it on, then it would be included. So
Or any
anything,
license. So it could be a nurse
yeah,
practitioner or a doctor or a DO, anyone who has is licensed, you could do it at this at a visit there.
yeah. So you just have to be creative if things are not on that list that you do, like biofeedback or Reiki or even a sound bath, like I said. Find the wellness center that has the practitioners that are listed in the holistic plan service practitioners. See them, add on the other additional thing, have it all on one visit or on the same day, itemized on the same receipt, and submit that receipt. Okay, so if your chiro doesn't offer massage or acupuncture, that would be another one of the 35 visits. Yes. Okay. Is there a way for the holistic plan to pay for a monthly charge? Yes. You would have the joint or whatever the lead fee is give you a bill for the monthly fee. And then you would submit that as a visit fee. Okay. Can you upgrade to the holistic from the holistic savings at any time? You still have to give them 30 days notice for any change, I believe. So definitely you can use the member chat function on the app to ask how to do that. Okay. Massages and physical therapy are covered under the holistic and holistic savings plan. Yes. Okay, Allison says, so I'm reading the pricing chart correctly for 50 to 64 plus family and kids is 1,229 a month for the 1,000 annual max. Does that annual max goes towards ER visits? Yes. Seems like a no-brainer for us to do the 5,000 annual max, which is 869 if that's a month. Yes. Since I'm paying $756 a month for traditional insurance and $233 for holistic just for me. Yes.
Yeah.
Yes, yes, yes.
Totally.
All the yes. Yeah. Do the 5,000 annual max, the family annual max. If there was more than one person that needed emergency medical care, that would be a 10,000 annual max for the family, but 869 for the medical emergency and the holistic plan for your whole family, or at least for you and the rest of your family. Sounds like a no-brainer. Yeah. How do you have an HSA with this plan? Clearwater has HSA offerings if you want them. Allie, do you want to share how you have an HSA or HRA?
Yeah, my accountant has like put me in contact with someone who does HRAs, which is like it's through my Young Living LLC, just FYI. So it's through my business with Young Living. If you have an LLC or actually an S corp or an S corp, then you can get an HRA or an HSA directly with your own business company. If you are employed with a company, they can do an HSA. In many cases, they have them for you. And I know that Clearwater, on the Clearwater side, they do have availability. They have the ability to set up an HSA for you, but I haven't really explored that. And I'm sorry, I apologize for that. I just haven't needed to.
Okay. Elizabeth says, wish there was a provision made for disabled children over the age of 26. Yeah, I don't think that there is, but even just the ClearShare plan is still really reasonable and would
Yeah.
give better services and coverage than, the government assisted insurance plans. Are blood draws available? No blood draws, no wellness labs, no preventative labs are covered. If you do have labs that are due to a medical issue, you'd still have to pay for your annual max before your lab work would be covered. And it would need to be for a new diagnosis from enrollment. Okay, so they need a free account, free brand partner account to get the fast start bonus. And when they want to open up the rest of the compensation plan and be eligible for all the commission, they do need to spend 100 PV per month. So the first 2 months of somebody being enrolled in this health plan, you would not have to buy anything personally to be eligible for commissions. But after the fast start is over, you do have to purchase 100 PV personally. But if you're on the health plan, that would count towards some of that 100 PV. If you have a practitioner that's interested in sharing about the plan, but they don't want to have to deal with buying 100 PV, what I've done is I've told them, send them to me. I'm going to take care of all the questions, yada, yada. I'll give you a $20 or $25 referral fee for each person that actually ends up signing up for the health plan. And they're stoked because their patients are getting enrolled on the plan. They're getting a little bit of a kickback. They don't have to worry about knowing all the ins and outs and stuff about this plan. And then I get to be the person that enrolls them and helps support them. So that's another creative way of enrolling people, is to talk to holistic practitioners and small businesses. So if you purchase the plan now, you don't have to use up all your appointments by May 2027, but your 35 or 15 visits, depending if you're on the holistic savings or holistic plan, will reset. They do not roll over. So ideally, use them all. Okay.
Do you want to
How do
have,
you,
does anyone want to share anything? Or, I mean, I know we probably need to wrap this up pretty soon, but does anyone have a live question or a comment or a success story they want to share? Is that okay, Carol?
yeah,
Feel free to unmute. If not,
any unanswered questions? If not, okay. All right, so I'll upload it to the group
see,
once I
Michelle just
have,
unmuted.
oh,
I don't know.
someone have a question?
Hi,
Michelle,
hi, I did. Hi, thanks for doing this. This is great information. I was trying to put my question in the chat, but I don't think it went through. I know like a wellness spa owner that, where they do uh, like a med spa where they do massage and all other services. How do I determine if they will be covered, or is there some path for them to get on a list to be considered as a provider?
Yeah, there's no directory, there's no list of practitioners because there's no network. If you have a wellness spa or med spa, as long as the
Mhm.
massage therapist is licensed or in California it's certified therapists, then any massage is covered. If they're getting a facial, then that would not be covered. But if they did a
Okay.
massage and a facial, then 175 or 150, depending on which plan you have, right, would be eligible to be paid towards the total of a massage and a facial.
but if they want to be someone, just to clarify and also answer Naomi at the same time, if they want to be a practitioner who shares this plan, then you can be the one to enroll them and share it. And in that boards link I shared, there is a custom link that you just put your member number at the end, or when they sign up, they put your member number as the person that you referred them to sign up. So if that's what you mean, anyone can enroll any practitioner that's not already enrolled with Young Living.
I do
Okay.
have one,
Thank you.
yeah, I do have one question that came in privately because I don't know why, but what happens in a true emergency? Say you get in an accident and have to go to the hospital, stay there. There's no time to shop around. So then you would go on the app, or someone would go on your app, sign in, let the app know that you're in the hospital. Like I said before, you'd pay a 500 minimum just to get the hospital paid. And then the app would tell you how much, once you have the diagnosis, once you have the bill, what would be covered minus your annual max. Okay, I think that's it. So thanks again for joining us. And this is something that you can share once I have the recording up. It'll be on YouTube. And the main thing we want you to know is you don't need to know all the things. You just need to know that there is this plan available, the basics of the plan. There's a ClearShare medical emergency plan. There's a holistic plan that's insanely amazing. And there's a combo plan. And share this slideshow, or you can just share this video or the slideshow, and then people will enroll on the site. And then there are benefit representatives that are available to answer questions. They can have a free consultation up to 30 minutes, as many of them as they need. And there's a ton more like information on the main website. So we're just we want to encourage you, you're just the messenger. You don't need to know all the information that Allie and I know. The only reason we know is because we've been planning and helping create this plan from the very beginning. But you don't need to know all this. You just need to know the basics, and then send them your link, send them this video, or send them the slideshow. Okay, a couple more questions came in. Let's see. Is there a way in the VO to know? Nope, not yet. I wish. The PV, the point value of any member that is on the ClearShare plan, gets loaded up around the 25th of the month. So we don't get any notification of that. There's no way to do a report to run yet. At some point in the future, hopefully there will be a report in the virtual office so that we can know who is on the plan so we can follow up. I don't think any blood tests are going to be covered from Nova Vita, because most people are going to Nova Vita for preventative wellness, and no preventative wellness stuff is covered for
We
blood
need to,
tests.
I think, Carol, I think we should ask if people can use their preventative wellness visits internationally, because I
Yeah,
don't think we've specifically asked that before.
I think the issue with that is how will ClearShare verify that whoever
We're
people are seeing are actual
licensed.
legit people? Because they're
Yeah.
going to be concerned somebody goes and gets some weird treatment and then has some kind of side effect that's not good, and then they're going to say, well, ClearShare said it was okay or whatever, right? Care coordination still is a thing, but they're still planning it out with this new way of instant pay. So they're still trying to figure out how to make the care coordination program work. All right. Thank you so much, everyone, for joining us. That's longer than we had hoped, but hopefully that answers a ton of your questions and that you feel more confident about sharing about this plan. And like I said, I'll put the link to this video in the groups after I have it. Okay?